Hi, this is Dr. Centeno, and today we're going to talk about a topic that's somewhere between what I would call medical provider level and patient level, but it's an important one about using ultrasound imaging after stressing the shoulder joint to measure shoulder instability. Now, shoulder instability is kind of a big deal. It causes a lot of pain and dysfunction. Basically, the ball of the shoulder lives in a shallow socket that's normally held together by strong ligaments. And those ligaments provide stability, but still allow a lot of movement. And the joint can be unstable when the ligaments are damaged. That could be either through some trauma or just through long-term wear and tear. Quantifying all of this on an MRI, i.e. how much the joint is unstable, is almost impossible because an MRI is a static image. It doesn't move. And obviously instability is all about too much movement. So the test I'm going to show you has to do with pressing forward on the ball and socket joint of the shoulder and then measuring that motion. So you can see here that on the right I have an axial image of the shoulder where you can see the ball in the socket. One finger is going to push forward on the ball, and the other hand is going to keep the socket stable. And then up on the right there, you can see where the ultrasound probe would be positioned to get a look at what's happening with the stability of the front of the shoulder. So if you see here on the more stable left side, I'm pushing and not much is happening. That humerus or the ball of the ball and socket joint is staying stable. On the right side, you can see a lot more motion forward. That humerus is giving a lot more forward. It's moving more forward. So that one's unstable. So it gives you an idea of what it looks like. So how do you fix this? Well, we can usually help this with either precise ultrasound-guided prolotherapy or platelet-rich plasma injections. When it's really severe, we can stabilize this area with stem cells. The problem usually doesn't require surgery, and you can track the patient's progress after treatment by performing these stress ultrasound studies in the office. So we have a very nice metric to see if the shoulder is actually getting better over time. So thanks for watching, and have a wonderful week.